Bismillah ar-Rahman ar-Rahim. Today we'll speak about nutritional view for management of kidney disease. First of all, we start with introduction about main part in urinary system اللي نعرف انه يتألف من kidney, two kidney, ureters and bladder, urethra. They're what is called nephron, which is functional unit of kidney. The main function of kidney is include secretion and filtration, reabsorption, excretion, and renin secretion as a hormonal function, in addition to erythropoietin production. About 90 to 80% of erythropoietin in the body secreted from the kidney. Vitamin D activation is very important. Vitamin for mineralization of the body, skeletal part of the body. Activation of the vitamin D in the kidney from the liver, 125 hydroxycholecalciferol, and then activated to 125 dihydroxycholecalciferol in the kidney. So then there are many diseases affect the kidney. This is the vital organ, including the infection, autoimmune disorders and connective tissue disease, trauma, damage, for example, burns, surgery, renal stone, cyst formation, congenital or acquired, diabetes mellitus, and other systemic and metabolic disorders can affect the kidney, lead to many disorders in the kidney. That's usually classified into acute and chronic kidney disease. Chronic kidney disease developed gradually and slowly that affect many parts in the kidney and disorder in many functions of the kidney. There is some term in this lecture. You should learn about uremia, what the meaning of the uremia, what the meaning of dialysis, nephritis, glomerulonephritis, nephrosclerosis, and polycystic kidney. This term definition is present in this slide. So after that, we will start with a nutritional treatment of renal disease, patient with renal disease. We know that the diets contain main parts or main elements. That's protein, carbohydrate, fat, fluid, electrolyte like sodium and potassium, phosphate, and so on. So for each type of food or nutrition, have special dealing with patient with renal disease. Protein, we should give the patient with renal disease sufficient amount and controlled amount of the protein to prevent malnutrition and wasting of the muscles, and from other part or other view, avoid damage to the kidney from over intake of protein, especially animal protein. Energy requirement should be depend mainly on the carbohydrate and fat, especially good fat, the unsaturated, poly or mono unsaturated fat, to avoid dyslipidemia and hyperlipidemia, which is also have harmful effect on the vessels, including renal artery and renal vasculatures. Fluid and sodium may be limited, and usually it is not need to limit it in all situations. When there is no edema, when there is no hyponatremia, so fluid restriction is not needed. Otherwise, sodium, it's also usually taken in sufficient amount, but overuse of sodium, especially in patients with edema, may aggravate the fluid collection. Phosphate should be reduced, as the phosphate increased in many renal disease and lead to destruction and what is called osteomalacia, which is mineral bone disease. Vitamin D usually added to patient with renal disease, especially chronic renal disease. Increased need for other vitamins, B and C and D, but should be avoided special vitamins in patient with renal stone. Vitamin C should be avoided, and vitamin D as added supplement supplementary drugs in form of vitamin D should be avoided in patients with renal stone. Increased need for vitamin, mention about the iron. Iron is important, and many chronic renal disease patients need to add some dose of iron. Potassium should be restricted and reduced, especially the diet which is rich in potassium should be reduced in patients with chronic renal disease. Hypolipidemia and related nutrition disorder, liquid vitamin and mineral deficiency are common in patients with chronic renal damage. Preventing malnutrition through periodic visits is very important, and sometimes, especially in patients with proteinuria and advanced and progressive renal damage, need a renal nutritionist. Routine and regular visit for this physician or for this specialty is important. Can reduce and can prevent many complications in the renal disease. High biological protein intake should be maintained, while sodium, potassium, and phosphorus intake are restricted. Protein target vary depend on the chronic kidney disease stage. The protein and other major electrolytes have a special concern according to the stage, what is called stages of chronic kidney disease. We should know about the stage of the kidney disease. ممكن نخلي لكم يا فد homework فد واجب بيتي انه تطلعون على الستيجنج of chronic kidney disease. حسب هاي الستيجنجز ممكن ان نعرف الاماونت البيرامبل اماونت الكميه المسموح بها للبروتين والبعض انواع بعض الالكترولايتس للمريض اللي عنده chronic kidney disease according to the stage. For example, if you start in this diagram from stage 3 and stage 4 and stage 5, according to this stage, there is a special limitation and control of protein intake daily, about 0.7 gram per kg per day of protein. Phosphate also limited to certain amount, potassium, sodium, and calories daily intake is limited in this diagram. Fluid restriction, as mentioned before, should only be instituted if there is hyponatremia. The reduction of sodium and phosphate intake is much more important than restriction of fluid intake in general, unless there is hyponatremia. 24-hour urine collection of sodium and urine nitrogen, serum creatinine is good informative indicators for compliance of the patient with nutrition and nutritional recommendation. For example, sodium as much as possible, less than 100 milliequivalent per 24-hour urine collection. To prevent lean body mass, supervised exercise is to preserve good body mass and avoid obesity, avoid overweight. For some special controlled regime of exercise is recommended and needed to the patient with a chronic kidney disease. Patient with proteinuria at any stage of chronic kidney should be referred to renal nutritionist and dietitian. We mentioned that some food with high potassium level, some food with high phosphate level. هاي الأنواع من الأغذية اللي بيها نسبة عالية من البوتاسيوم أو نسبة عالية من الفوسفات لازم نقلل الانتيك مالتين أو نتجنب الأوفر انتيك of this food type, these types of the food in patient with a chronic kidney disease. مثل الأمثلة على الفودز with high potassium content الديتس, الافوكادو, الناتس, الميلكس, الاورنج, البنانا and so on. كذلك الفودز اللي تحتوي على phosphorus, high amount of the phosphorus أيضا should avoid over intake of this food in patient with a chronic kidney disease. There is what is called nephrotic syndrome. Nephrotic syndrome أو ما يسمى بعض الأحيان التناظر الكلوي. Nephrotic syndrome هو فد syndrome, not disease. Many systemic and metabolic disorders in the body can lead to this syndrome, nephrotic syndrome, مثل الدايابيتس, مثل الدراجز, مثل الأوتو إميون بروسيس, مرات يكون idiopathic destruction of the nephron lead to what is called nephrotic syndrome, which is collection of the significant proteinuria more than equal 3 grams per day in most of references, plus hypoalbuminemia, plus dyslipidemia, plus generalized edema. Nephrotic syndrome has many causes, as we mentioned before. Dietary management concerned on good protein supplement to this patient, as there is protein loss in urine, abnormal protein loss in urine. So special limit of protein or special sufficient supplement of dietary protein to patient with nephrotic syndrome is important, generally about 1.5 to 2 grams per kg per day. This increased if there is persistent proteinuria to 0.5 gram per kg per day. The fat, we also concentrate on good fat and should be less than 30% of calories intake daily. Treatment with steroid in patients with nephrotic syndrome, in most cases the main part of treatment consists of corticosteroid. العلاج الرئيسي لحالات التناظر الكلوي يكون الكورتيزونز، البريدنيزولون او other form of corticosteroid يمثل الجزء الرئيسي في العلاج. هذا بحد ذاته ابيتايزر، بحد ذاته ممكن يزيد شهية المريض، ممكن يزيد الوزن مالته، وبالتالي يحتاج good nutritional supplement. regulated exercise مهم بهذا الموضوع. طبعا البيشنت ايضا ما دام تطرقنا لموضوع الكورتيكوستيرويد، المريض او اللي عنده نفروتيك سندروم عاده الكورس مال الستيرويد يكون prolonged more than 3 months. هذا المريض وحتى باذر ديسيز اللي ياخذون كورتيكوستيرويد لفتره طويله اكثر من 3 اشهر يحتاج سبلمنت، لانه لا يبل المريض يصير عندهم اوستيوميليشيا، يصير عندهم نقص بالكالسيوم، ويحتاج supplement in form of the calcium and vitamin D. In general about 250 international unit or less, 125 international unit to 250 international unit of the vitamin D, and calcium in form of 250 to 500 milligram of calcium daily. Other subjects or other disorders affect the kidney is renal disease. It is generally common even in our country. فشي شائع جدا حصات الكلى بانواعها المختلفه، وخاصه الاوكزالات، كالسيوم اوكزالات، كالسيوم ستونز. الكدني ستون هي روك لايك كريستال وتتجمع سبيشال كونديشن، سبيشال كونسنتريتد يورين، وتتحول ممكن باي ذا تايم تو سبيشال شيب اند سايز اوف ستون. The main risk factor to development of stone هو أن يكون الإدرار too little urine with a lot of mineral waste inside the urine. In general, there is 4 types of the kidney stone. تشمل calcium stone, phosphate, calcium phosphate and calcium oxalate, واليوريك acid stone، وستروفايت stones اللي تجي من الانفكشن nidus of infection، والسيستين ستون اللي هي rarely usually occur in congenital condition or hereditary disorder. طبعا determining of type of stone is important in prevention of recurrence and the treatment of stone in patient with renal disorder or renal stone. In general recommendation in patient with renal stone يعني ننصح شنو النصائح اللي نقدمها، التوصيات اللي نعطيها للمريض اللي عنده حصات الكلى. اهم توصيات هي معروفه ومتعارف عليها انه a lot of water، دائما حتى الناس العاديين يعرفون انه اشرب ماي هواي ممكن يخف الادرار مالتك ويقل السوليوس ويقل التراكم الحصات وتكوين الحصات راح يقل. فاذا drinking of plenty of fluid is very important in prevention and management of renal stone or kidney stone. At least for example 2.5 liter per day، ونوزعها divided over the time of the day or hours of the day. تقريبا كل ساعة أو كل ساعتين cup of fluid or water حوالي 250 cc each hour during waking hours طبعا، وبefore أيضا before sleep أيضا ممكن ناخذ فد good amount of the water is or fluid is very important. طبعا avoid الشوجر درينك بشكل عام. good to take natural juice, fruit juice. ليمون juice is good لأن بي good amount of citrate. الليمون كمية الستريت بيه عالية وممكن يكون الستريت هو prevent stone formation. Drink about 100 of lemon juice daily, could be added to water or without water. الكوفينيتد درينك أيضا لا بأس به to prevent kidney stones. However, limited for about 3 cups of caffeinated drink per day. Try to decrease body weight and avoid obesity. Otherwise, if there is a specific form of stone, we have a specific form of stone, for example, the calcium oxalate stone, limit the salt. Sodium is important to be reduced to less than 2.3 gram per day. Reduce أيضا some food that rich in oxalate مثل fresh meat, chicken اللي بيها salt وبيها oxalate. السبيناتش ممكن أيضا بيها good amount أو large amount of the oxalate. In addition to that, sodium أيضا should be restricted. البروتين أيضا is important to be reduced. The animal protein especially should be restricted and controlled amount taken daily. Do not add salt at the table or in cooking for this patient with calcium oxalate stone. What can I use instead? There is some substitution for the usual salt أو sodium chloride salt اللي هو ground pepper, dry mustard powder and other form. Yes. Chocolate أيضا peppermint tea, soy, wheat bran and wheat jam, all these strawberry, all these foods with a large amount of the oxalate, أيضا as much as possible reduced in daily food. New research has suggested that eating and drinking high calcium and oxalate food is good. Food or drink together is important to avoid absorption of oxalate. So in patients with calcium oxalate should not restrict calcium intake. يعني يجوز اكو فكره خاطئه عند البعض انه اذا مريض عنده كالسيوم اوكزاليت ستون لازم يقلل من الكالسيوم in the food. الحقيقه الفكره مو صحيحه. فحتى الاوكزاليت الموجوده بالاطعمه الموجوده اذا ياكلها المريض وياكل وياها اطعمه او يشرب وياها اشربه rich in calcium ممكن يمنع امتصاص الاوكزاليت وتطلع without formation of يطلع بالباول through the bowels بدون امتصاص وبدون خطورة الرينال ستون كالسيوم اوكزاليت ستون فورميشن. فإذا ماكو ريستركشن للكالسيوم عند المرضى اللي عندهم كالسيوم ستون، ولكن نتجنب الادد سبلمنت يعني الادويه اللي بيها فيتامين دي وكالسيوم ذن نتجنبها. اما الاطعمه فماكو مشكله بالكالسيوم، بل بالعكس ممكن انه encourage the intake of the calcium rich food in patient with calcium oxalate stone like milk and other. Include adequate calcium in your diet as mentioned. For example, 120 milligrams or cc of calcium rich food or drink. Dietary calcium is important for your bones and teeth. Adequate dietary calcium intake of 1,200 milligram per day is recommended. This 1,200 milligram of calcium can be listed as different form of food and drink. Other recommendation is to avoid and reduce animal protein as much as possible for about 120 grams. In general, about 60 grams of meat equal to about 2 eggs. Vitamin supplement. We avoid in patients with calcium oxalate stone, avoid vitamin C, also avoid vitamin D supplement or cod liver oil. Vitamin B, there is no proved harmful effect of vitamin B on renal stone, calcium oxalate renal stone. Whole meal and whole grain food in general is good for patients with calcium oxalate stone. Other form of stone or other type of stone هو uric acid stone. طبعا we should reduce purine rich food, include red meat, mackerel fish, shellfish and other. أيضا alcohol intake should be reduced or stopped. Limit sugar sweetened food and drink. Increase fruit and vegetables intake. We should remember that the important risk factor for development of renal stone is too little urine amount, concentrated urine with large amount of dilutes minerals inside the urine. This may be important risk factor for renal stone occurrence and recurrence of renal stone. So more urine, less stone forming minerals can protect kidney from stone. Drink more fluid, and right type of fluid is also important protection for kidney against renal stone formation.